So there's been a lot of information going around about SNOMED CT. Now SNOMED CT, and I'm going to have to check this, is a Systemised Nomenclature of Medicine - clinical terms. It's a standardised international multilingual core set of clinical healthcare terminology that can be used in an electronic health record. But what really is SNOMED? Essentially, SNOMED is codes that relate to procedures, among other things. So for an amalgam filling, there's a SNOMED code for the fact that it's amalgam filling, how the procedure was carried out, the tooth it was carried out on, and the surface combination that it was carried out on. So for a dental practice, it will mean every procedure or bit of information they record should be able to be turned into a standardised code, which can later be transmitted to the BSA, who can then perform data operations on it. As it stands, the implications for dental practices is unclear because we don't know how the SNOMED data is going to be used. The other really important thing to remember is, at the moment, that data is not transmitted externally to Pearl. There's no receiver at the BSA for it, so that data will only exist within your Pearl dental software database. So within the Pearl system, we've gone through the standard treatment list, so that's basic things like amalgam filling, composite filling, and we've applied the SNOMED codes we've been given that we think are suitable. It's important to remember that it is a clinical decision at the end of the day, so we would recommend to all our practices that they go through all their codes and just verify, make sure they agree with the codes we've chosen, along with anything they may have added that's kind of non-standard won't be assigned a code by default. Once you've assigned all your codes and you begin charting, the Pearl system will automatically assign the chosen codes to that treatment when you use it. There's a few exceptions to this, so if a treatment has multiple codes that could be relevant, but it can't be both, Pearl will pop up and advise you to choose which code you think is more suitable for what you've done. So our only advice at this stage would be to go on your Pearl dental software system, go to your treatment codes, go through and check the SNOMED codes assigned to each treatment item. Make sure you agree. If there's things that haven't been assigned codes, assign them codes, and essentially wait until further notice. The Pearl system will start recording SNOMED information straight away, so it's important that you've got the defaults correct.